the mandatory use of the ArriveCAN app has been criticized by frontline border agents themselves. Those are folks that are part of the union, folks that work in the government, mayors, tourism councils, chambers of commerce, our U.S. border partners. Actually, it would be easier just to list those who support it, and that's only the government, sir. It is adding delays. It's quadrupling the time at customs. We know that. That's on record. People are being wrongfully put under house arrest because of a glitch. It functionally does not keep up with the political health restrictions. It has been cited as having privacy issues. And the one-time secret exemption uncovered last week proves that it's not even about viral spread. So in the face of the overwhelming evidence on its problems and the criticism, why is the government not abandoning the mandatory use of ArriveCAN? And why are you instead making it permanent?
Mr. Chair, Ms. Landsman in January claimed that the vaccine mandate at our borders would lead to food shortage and empty shelves at our grocery stores. She was wrong. In May, she claimed that the transportation vaccine mandate as causing the congestion, and if we stopped it, it would solve the congestion problem. Once again, she was wrong. So I can tell you, Mr. Chair, Canadians would forgive me why I'm skeptical about her assessment. ArriveCAN is not contributing to the congestion. In fact, ArriveCAN is a useful tool that helps verify the vaccination status of an individual before arriving at our borders. If we didn't have ArriveCAN, the processing of arrivals would take longer time because it would have to be done manually.
10 more seconds, Minister, please.
ArriveCAN is actually helping process arrivals much faster and helping reduce congestions.
Do we have any evidence, Minister, that the ArriveCAN app is suppressing cross-border travel and tourism? Because, you know, tourism is very important. We have a wonderful country, and our neighbors to the south are wanting to visit our great nation. As far as you know, is there any evidence that this is being suppressed?
15-second response, please, Minister. Thank you.
There is no evidence, Ms. Katrakis. However, I am aware that several border communities have been flagging this as an issue, and we will continue to work with them on ensuring how we can increase the facilitation of international arrivals. But let me just state this. At airports, international arrivals currently at 99.5% compliance rates. That is almost 100%. There is no evidence whatsoever that ArriveCAN is causing any problems.
Minister, if there was no scientific basis for mandates, as has been indicated by officials, why would your government institute a policy that infringed on Canadians' rights, that didn't have scientific basis, and then call a snap election a couple days later?
You mean the non-scientific mandates that was implemented by municipal governments? You mean the non-scientific based mandates that was implemented by provincial governments? You mean the non-scientific based mandates that was implemented by the private sector without required from government? You mean the non-scientific based mandates that was implemented by universities? You mean the non-scientific based mandates that was
Minister, I'm talking about the mandates implemented by the federal government at airports.
Governments around the world.
I'd like to quote one of your officials in court documents that were reported on by Rupa Subramanya, and one of those officials is on the call today, actually, and let me quote in an email. To the extent that updated data exists or that there is clear evidence of the safety benefit of vaccination on the users or other stakeholders of the transportation system, it would be helpful to assist Transport Canada supporting its measures. That's a quote from ADM McCrory. Now, the mandates were set to be implemented, but your department didn't even have the information that indicated it was necessary or based in science. To just circle back to your question about the science that's being followed by municipalities and provinces, they have all eliminated their mandates since, yet you have not. So if you're following the same science they are, why have they all lifted their mandates, but you have not?
Mr. Chair, first of all, let me start off by saying vaccines have proven to have saved lives and continue to save lives. At a moment in time where our public health system is under a lot of pressure, vaccines continue to be an incredible tool in saving lives and protecting the health and safety of Canadians and our healthcare system. The federal government has suspended most of our mandates. The only mandate that we have is at our borders, like many countries around the world. And it is done to ensure that we minimize the importation of the virus and that protect the health and safety of Canadians. And let me point my honorable colleague, on top of all studies that have been done over the last 2 years, just the last 2 months, 2 different studies. One was done by the Canadian Medical Association. One was done by UBC, the University of British Columbia, that demonstrated that these public health measures, including mandates, protect the health and safety, have saved upwards of 60,000 lives, have prevented the importation of the virus tenfold at our borders. So there's ample evidence that I'm happy to table with committee that provides justification for these vaccines.
Well, thanks very much. We look forward to you tabling that information. Over 60 countries around the world have abandoned all of their air travel pandemic restrictions, including most of our European allies. And, PHAC internal reports suggest that air travel had almost no impact on COVID community spread, less than 1%. So it is questionable why those would still be in place. The minister, you're talking about, again, about science. The CDC in the United States, with whom we share a border, says that it makes the most sense not to differentiate between the vaccinated and the unvaccinated, and that sub-jurisdictions don't need to start making mandates. So, Minister, let's talk about the mandates that you still have in place. What are the current regulations for air and train travel in Canada with respect to COVID-19?
Mr. Chair, there are still many countries around the world that require a proof of vaccination for international travel.
Your mandates, Minister. I've got less than a minute.
Second, currently, the Canadian government has suspended our vaccine mandate for our transportation sector, so there is no requirement for domestic or international travel for people who are leaving the country, whether they want to get on a plane or a train.
So, Minister, do you have to wear a mask on a train or a plane? And if someone does not, what should be the consequence for that person?
Currently, we maintain a mask-wearing policy for federally regulated air or train sector. It is scientifically proven that masks reduce transmission upwards of 80%. We're doing everything we can to protect the health and safety of Canadians, and it is the prudent thing. In fact, it's the kind thing to do to protect
10 seconds,
those
please, Minister.
sitting next to you.
Minister, your Prime Minister was seen not wearing a mask on a train just mere weeks ago. Was that not prudent or kind of the Prime Minister?
You can follow up on that question at the next round, Mr. Barrett, or perhaps one of your colleagues can.